are effective to treat and cure COVID-19. Currently, we should adopt a meticulous and careful mentality in using and applying drugs. And there are many drugs, their efficacy are observed on a theoretical basis or on some initial experiments, but it's hard to say whether it's truly effective or not. Maybe there's some political reasons behind it to pacify the general public. In the life science area, sometimes people are not entirely relying on the facts, but we should adopt a scientific mentality to prove it. So this is the answer to the three questions.
谢谢刘院长的回答。您实际上不仅仅回答了这几个问
Director
题。
Liu. You not only answered the three questions, but also you mentioned very important principles in clinical application of medication. Thank you. The second question is from Nancy from Peru. The question is, compared with fever patients, COVID-19, what are its more representative symptoms? If PCR is false negative, what is your approach or method to cope with it? I'd like to ask Director Chen to share your experience.
好，院长。
好，谢谢朱院长，谢谢
Director Zhu, and thank Professor Nancy. A very professional
关于这
question
个新冠肺炎呢，它的代表性的
about COVID-19. Typical symptoms
一个是成年人，
for adults:
发热、干咳、
fever, coughing, fatigue are the major symptoms. For some minorities,
流鼻涕，
they have pain in the throat and
对
nose.
于这个重症的患者，不发生在这个病
And
的
for severe cases,
出现这个呼吸困
for
难，
example, they might encounter respiratory difficulties after 1 week, or low oxygen level in their blood. Or even more severe cases, it might evolve into comprehensive and acute respiratory disease.
症休克，难以纠正的代
Even
谢
faint,
和出凝血
or they can have metabolic
以及
acid
希望功能代谢等。
poison.
值得注意的是，重症危
Even the
重
organs can fail
在病程中
eventually.
可为中低的，甚至无明显发热。
But for some people, they don't have obvious symptoms. And for children and newborn babies, they don't have typical symptoms. They have diarrhea or some other digestive system symptoms.
精神弱，
Or they just feel tired, fatigue, or with very short breath.
与同龄患者相近。这是第一
And
个
also for pregnant
关于这
women,
个
we should adopt similar clinical approaches
这个问题。
with the same age people.
这个本身不是百分百，它这个假阳性可能更假阴性可能更多
And。there are certainly some false negative cases because nucleic acid test is not 100% accurate. So negative forces do exist. CDC of China
查这个核酸检测之外，
will not only test nucleic acid, but will also test the serology,
这
the
个
antibody.
有两种，
Nucleic acid has two types
一种就是
and two situations. The first one
内分泌误导，
is to test the respiratory secretions,
当然呢还有这个粪便检测，
including throat swab.
再一
And
个
also, there are medication and drug tests
血液的有血清抗体的检测。我这个分成一
in
个
order to test the
定量，
antibody in the serology. So we use both qualitative and quantitative method to test the IgM and IgG,
定量来说
the，antibody of the nucleic acid,
这些都是比较。
IgG and IgM.
第二个就是还有一个基因的检测，
Secondly,
基因检测
genetic
这块儿
testing.
分这个两种， 一种这个
At present, there are two types of genetic testing,
两种基因的检测，也就是 ORF 和这个
ORF and
1AB。
1AB.
第三种有三
The third one
三基因的检测，ORF 和这个
is ORF
EG 和 NG。
and 1G and EG and NG.
ORF 连续两
If
次
ORF
就可以确诊。
are positive consecutively for 2 times, then it will be confirmed.
也可以确诊。
And that also applies to ORF. If ORF is negative,
最近呢 EG 和 NG 是阳性的话
only EG and NG are positive, then a re-examination must be performed. This is my answer to the question. I'm not sure if it answers your question. Thank you, Dr. Chen.
第三个问题
Let's take a look at another question from Romania.
因为我们早期没有充分的检测设备，有很多发烧的病
He
人
said because we do not have sufficient testing equipment, many fever patients or patients feel uncomfortable visit the hospital. So from a hospital management perspective, how to identify them as soon as possible to prevent virus from spreading in hospital? Director Liu, please. Can you answer the questions and share your points? Thank you, Director Zhu, and thank friend from Romania.
各家综合性医院
In China, the comprehensive hospitals have a fever department. So all fever patients must be categorized by this department and then sent to different
医生一个非常重要的一个
clinic setting.
工作，要
And
详
a very important work of the doctor is to inquire the patient very elaborately whether this fever patient has close contact history with COVID-19 patients. So to inquire medical history of these patients. If the answer is yes, and then the patient has some respiratory symptoms, even if there are no sufficient nucleic acid result, but clinically
病人白细胞正常或者降低，
we can detect the lymph cells whether they are at a normal level or not, and also combined with a CT test
如果能做的话呢，
as well as a MEMBA test,
确实是
the white blood cells level,
和其他
to
的
clinically diagnose the patient.
乙型流感都有
And
相似。
also, COVID-19 has some similarities with influenza A and influenza B. So we start from suspected cases, and then nucleic acid will be applied to confirm the
就
cases.
应该把它
If we identify suspected cases, we will quarantine him or her to a designated site for specific
核酸
treatment.
检测出来以后，我们再把它
And after nucleic acid test, we will then allocate and transfer him or her to the designated hospital to prevent cross-contamination or infection within the hospital to protect the patients with other diseases. Thank you.
谢谢李院长。我想再
Thank you, Director Liu.
一个问题
I'd like to ask a follow-up question. This question is from
他问
Carlos Paris from Peru.
医务人员个人
He asked,
和协议的要素
what are the most important factors to safeguard medical staff? So it is about some management and legal perspectives. I think this question includes two aspects. At least that is my understanding of the question. First, thank you, Carlos Paris, for asking the question. The first aspect is about the safety and the protection of the medical staff. Indeed, it is very important. There are several points I'd like to make. For one, in the work zones within the hospital, there must be a very clear division of different zones. The contaminated zones, semi-contaminated zones, and non-contaminated zones. And there must be very clear signage indicating different zones. In particular, in the egress and ingress points of the contaminated zone, there must be specific personnel to monitor the egress and ingress of people. For example, in our hospital, there are professional personnel to monitor the egress and ingress, and there are indicators.
全员的培训，
Secondly,
而不是说单纯我们医护人员
a training
包括保洁
must be performed. So that involves all the personnel in the hospital, not just the physicians and nurses, but also the security guards and all the working staff in the hospital.
第三个的话是医务人
And
员
thirdly, the protection of the medical staff. It depends on the specific tasks he or she is performing. For instance, in a clean zone, maybe level 1 protection is needed, but in the semi-contaminated or contaminated areas, for example, personnel responsible for imaging or delivery of samples, they should follow level 2 protection protocol. And for contaminated zones, they must adhere to level 3 protocols. So that means they must wear a protective suit and facial mask. And the second aspect of the question about protocols, I think this is different in China. China, the predominant models are public hospitals, and medical staff in the public hospitals can enjoy all the benefits in terms of compensation, medical insurance, and specific subsidies from the government. For example, in Wuhan, we
那最是
came to the rescue. Wuhan, and this is a special occasion. After the outbreak, no one single medical staff
所以说我们中国的这个
requested to go back.
到那去
So for Chinese medical staff, we volunteer to aid other cities. It is also their obligation.
没有什么
They
钱
went to where they are most needed.
他回来
So there are no agreement being assigned to motivate the medical staff. They went there voluntarily.
谢谢李院长。哎，院长，我再
Thank you, Director Liu.
如果说
Another
我
question.
们的防护物资不够，
If we don't have sufficient protection materials at the very start of the outbreak, how will you distribute the medical
这个
resources and materials?
确实
Speaking of medical materials, I think it's a matter of logistics. When the outbreak just took place, we encountered similar difficulties. Medical materials and resources are very hard to come by. However, our logistics
就是我们每个人
relies on the concerted efforts of everybody. When people enter into the quarantine zones
这里面是
or the endemic areas,
我们当时的话
they will be provided with medical materials. I asked my medical team to share all of our medical resources. We are in it together to solve the problem. Thank you.
谢谢李院长。
Thank you, Director Liu.
来自埃及的 Mustafa 的先生，
Yes.
他问的问题。
Mr. Mustafa from Egypt, he asked, in a special time, how many respirators, how many ventilators are needed for 100 bed? So it depends on your specific situation and department. If you're in an ICU, then you need the same number of ventilators
但是这里头的病人
with beds.
应该要进 ICU，但是进不了，因为
But there are
ICU
some patients
在这种情况下
that they can't be taken into the ICU because it's full. So the hospital should prepare more ventilators. Just like Director Liu has mentioned, we encountered shortages of medical
后来的
resources, including ventilators. And later on, when the logistics and supply went up, we can use more instrument to save more patients. And I'd like to remind you,
国外的各位同道们，
for our overseas fellow practitioners, you should prepare
我觉得这也是
whether the oxygen level is adequate or not. I think this is also critical because under these circumstances, we need a very high volume of ventilators
来的这些病房
to
的
oxygenize the patient.
流量是不够的。
But in some hospitals, the level of oxygen in the mechanical pumps, tubes are not sufficient.
压力提高压力，才把这个问题解决。
So we are also adjusting the pressure within the wards to solve the problem. So ventilator is one thing, but we also should concern with ourselves with the level of oxygen. And another question from Brian from Ecuador. He asked, how long would it take for the epidemic to be controlled or eliminated based on your experience? I think now it has entered into global pandemic. So Chinese solution alone cannot address it entirely. It takes some time. The previous directors have mentioned, if we implement strict quarantine measures like city lockdowns to cut off the source of the infection, from this perspective, and then we treat infected patients.
爆发的最严重的这个地方，我们应该是
For Wuhan City,
月的这方面的斗争。
the most severe zones, after 2 months, the new confirmed cases have been reduced to 1 digit and even 0. But this does not mean and does not represent the global situation, because we are now in a global village. We are facing global pandemic. We cannot stop movement of people in the world. So
控制传染
we and the rest of the world,
性的手段的
we are adopting
强度和持续的
a
强度。
measure to cut off the source of the infection.
说起来，曾经也想过，是不是温
Speaking
暖
of which,
会
maybe we thought that the temperature is going up, maybe the epidemic will be contained. However, we still found COVID-19 patients in South America.
我们
So
要
this reminds us we should stay vigilant.
中国来说起来，除了注意输入型的病例以外，我们还
We
要
should
注
not
意
only care about the imported cases, but also
如果我们在流行病学
domestic cases.
在隔离、在监测方
In
面
particular,
疏漏的情况下，
if we didn't successfully monitor these a few cases, then it will waste all our previous efforts. Just like the previous colleagues have mentioned, the cutoff of infection source
这方面花了
are the most critical thing to do. We spent a lot of energy on it.
没有办法去
So from this perspective, I cannot really give a time, like how long will it take to eliminate the virus, but it's really a global effort. We are in a global village, and from this perspective, we should join hands to fight against it.
好像有一位外宾在要等着上线是吧？主
I
持
think
人，
there's one overseas expert that is trying to be connected.
陛下是不是有个上线的？
Is that right?
是的，这位外国专家已经上线
Yes.
了。
This overseas expert is already online connected.
这位外国专家， 声音有一些故障。
This overseas expert encountered some technical issues. Please take off your headset. We cannot hear you.
朱院长，
哎，
朱院长
Director Zhu.
咱们可以先继续看
We
别的
can
问题。
proceed
好的，好的，好的。
to answer other questions.
等会儿啊，我再看看他们的问题。
Okay, wait a minute. Let me review some of the questions.
哎，我有位外国的所问的一个问题，他说
There's
他
one
出
question.
现了味觉丧失和
He said
嗅觉丧
The
失。
loss of the sense of smell and the sense of taste. So is this symptom also related to COVID-19? I don't know if the other three directors encountered similar situations in your treatment. In our ward, I didn't encounter similar situation. The loss of the sense of the smell and the sense of the taste. So I think this is a neurological damage, right? In my ward, I mean for COVID-19 patients, we only observe damages in the lung and also in the heart, in the cardio system. But for other organs, I think it is more of a neurological damage. I didn't encounter similar situations.
可能是一个个例的观察吧，我们还要做更多的。
So it might be an individual case. I need to do more work to understand the nature of it.
再问个问题
Another question.
生物安全性的角度
From a biosafety perspective,
是不是对
is N95 facial mask effective
其他的
to prevent the virus from spreading?
那么这种情况下，我们要采取怎么样的这种的方法来保护，另外来控制它的传播？魏院长，
So which director would like to answer the question? Is N95 facial mask effective? I think N95 from our usage in the mobile cabin hospital, N95 facial mask were used to better protect people. We even added an additional layer with ropes on it to make it tight, and it would be sufficient.
还有一个对抗别戴口罩，双方都有，避免戴口罩，减少这个飞沫传播的这个风险，大家都得注意。从我们的
It can reduce the risks of being infected. From our experience, N95 can effectively prevent the virus from spreading. Thank you.
曾经是做过这个。痰盂的肺功能的损伤这个问题，现在也已经被提上了议事日程。所以，怎么样来跟踪这些病人？您有什么体会吗？
There's some residue lung damage that are being observed. So, will any follow-up visits be made?
肺功能啊，因为呢是还需要
Regarding the residue lung damage, it takes some time to observe.
社区以后，我建议啊，还得定
I would
期
suggest
医院的互动，
to have a
我
regular
们进一步观察呀，
follow-up visit
新冠对肺炎
with the hospital
可能造成的影响。
to observe the impact of COVID-19 on lung. It's different from SARS.
现在啊，我们观察的，包括文献上看
Now,
到，
based on our observations and in the literature and in our clinical
纤维化的倾向
side,
没有 SARS 呢明显。
we believe compared to SARS or COVID-19, the fibrosis of lung is not as significant as SARS.
遗留啊，就是说这个肺纤维
So
化
it's not necessarily will result in residual lung damage, but it takes some time. It is a process. So there must be follow-up recuperation phase.
一个新的疾病，还得
And since this is a new disease,
能够发现这方面
I think still we need some observation to evaluate residual lung damage and how will it affect lung in the long term. We need more materials and more time to answer this question more precisely. But after patient is sent off hospital, the patient can do some exercises like deep breathing. I think these are necessary recuperation techniques.
陈院长，
哎，你好，你好。
亮亮，就是我相信每一个医疗队，包括
I believe every medical unit, including the ones in Wuhan Hospital, they will more or less use GC, glucocorticoid.
我觉得您能不能跟我们分享一下关于
So can you share with us what's your take on the usage of GC?
这样，我们主要是这次这个接管的是青山方舱医院。
So we took over Qingshan Mobile Carbon Hospital this time. We admit in mild cases. We admit 519 mild cases. We have 73% of cure rate. And so far we have not used GC. But my point is, Director Lee has also mentioned this point. I was responsible for the imaging. So for the over 500 patients, I look at the image of their lungs. And it's fair to say that over 75% of patients have a very, very good lung performances after the treatment. After over 15 days of positive treatment and TCM therapies and Western therapies combined, they have recovered rapidly. And over 80% of the patients have had a very good recuperation. Only a small portion of patients had more difficulties in recuperation. And for those patients, they have some existing diseases like diabetes. So for them, it takes a longer time to fully recuperate. And there's another phenomenon. For women that are obese, their recuperation speed is not as good as the others. So these are just some of our observations. And we still need a follow-up visit to understand more. Let me add some points regarding GC. The applying of GC to treat lung damages caused by viruses from SARS to COVID-19. SARS took place like more than 10 years ago. We used a large dosage of GC in our hospital. There's still some patients have been badly affected by SARS, and they are still in our hospital even after 10 years. However, if we apply GC at early stage and with a moderate dosage, we can consider use it. And if we found it useful, we will continue to use it for some time, for 3 to 5 days. We'll observe whether the symptoms of the patient is improved or not. If there's no significant improvement, then we will reduce the dosage and be more cautious. GC is a double-edged sword. If misused, it will cause many terrible side effects, like further infections or make it worse. So clinical-wise, we are exercise caution to apply GC on different patients. If this patient has very severe COVID-19 symptoms and there are no other alternatives, then we might try using GC to treat the patient. Thank you. For my medical unit, we've been engaged in a research. We're also using AI to read the lung image and also to observe the medication efficacy. So we are adopting a stratified philosophy to guide the administration of drugs. Now we are engaged in this research, just like Director Liu mentioned. This type of drugs are a double-edged sword. Hormone can be used well to treat disease, but if misused, it can also cause great damage. Is our overseas patient, overseas expert online now?
新冠患者，卫生部指定医院的专家，因为设备问题呢，没有办
This
法。
overseas expert from Ecuador has lost the connection. Did he write down the question?
问题的话，可能我们要期待下次了。
We can answer the question next time. Thank you.
我们是不是时间差不多了？
I think it's about time to adjourn the webinar.
主持人，我能借用几分钟？我想
Can I take a few minutes
刚才这位院长们所分享的问题，我做一个总结，谈谈我
to
自己。
summarize the other directors
我直接用
what they have said? I'll use English.
Thank you very much for all the participants around the world. Today, our topic is Chinese solution and global sharing. Really, we want to share our experiences and approach from what we have done in China to enter the COVID-19, this kind of disaster. Actually, we have been attacking this phenomena for more than 2 months. And we have some experiences, such as very solid isolation, and also a very solid and strict epidemiology study. And also we have also tried some the clinical therapy for these patients. I want to mention that in China, our National Health Commission issued from version 1 to version 7 the recommended protocol for diagnosis and treatment for COVID-19, which give us a very, very good, somewhat like guidelines for health professionals to do our work. In addition, these recommendation protocols from our National Health Commission also give us some waiver of the responsibilities for those drugs which have not been strictly tested or approved in the normal time, so that we may use these drugs which might show some relative or some parts of the efficacy to treat a patient. But this also depends on the capacity of the team working together in the